Mood stabilizer reaches a therapeutic blood level.
And remember, blood levels of some mood stabilizers such as lithium, Depakote, and Tegretol must be monitored regularly to prevent toxicity. Common side effects include nausea, polyuria, polydipsia, hand tremors, and weight gain. Toxic levels of lithium include vomiting, diarrhea, sedation, and confusion. Lithium is contraindicated for clients who have renal disease and/or cardiac disease and should be used with caution in clients who have diabetes or thyroid disorders. Here, the important nursing implications include education about adequate fluids, about 2 to 3 liters per day, and a well-balanced diet with a normal sodium intake. To avoid nausea, lithium should be taken with food. Tegretol can cause agranulocytosis and aplastic anemia, and Depakote can cause liver dysfunction, hepatic failure, and blood dyscrasia. Important interventions for mood stabilizers include monitoring blood levels to prevent toxicity. Liver and renal function tests and complete blood counts are evaluated to prevent serious complications. Psychostimulants are used for attention deficit disorders, to treat symptoms of decreased attention and concentration, increased distractibility, hyperactivity, and impulsivity. Common side effects of psychostimulants include weight loss, insomnia, headache, and tachycardia. As a nurse, you'll instruct the client to eat meals before taking the medication, monitor weight, and take the medication before 4 p.m. to avoid insomnia. The nurse should continue to reassess the client's response to the medication and document it in the chart. Sedative hypnotics. Sedative hypnotics are used for anxiety, panic attacks, pre- and post-operative sedation, and insomnia. These may be classified as non-benzodiazepines or benzodiazepines. Benzodiazepines can be habit-forming with excessive use and should be used for short periods of time only. Common side effects include drowsiness, a hangover effect, or slowed speech and impaired comprehension and confusion. Toxic effects such as respiratory depression can lead to death. Important nursing interventions include educating the client that the extended use can cause tolerance and physical and psychological dependence, and a withdrawal syndrome can develop. Benzodiazepines should be carefully tapered without stopping abruptly. These medications should not be taken with other medications without first consulting the physician or practitioner. Non-benzodiazepines can induce drowsiness and sleep and also cause side effects of drowsiness and dizziness. Long-term use is not recommended. Okay, here's a situation for you to think about. When a client requests sleeping medication at bedtime, which nursing action is best? You can ask what the client has done to relax and promote sleep, and educate the client about ways to promote sleep without an anti-anxiety medication or a sedative hypnotic. All psychotropic medications should be used with non-pharmacologic treatments such as counseling, behavioral techniques, environmental changes, stress management, relaxation for sleep, and an ongoing therapeutic relationship. Promoting compliance with medications is essential. You must include significant others or family members whenever possible. Instruct the client about the name and purpose of the medication. Provide written instructions as necessary, and identify who the client can call with questions about the medication. Clients must understand that they need to take medications as prescribed without decreasing or completely stopping their medications as soon as they start feeling better. Okay, let's talk about something you may all be experiencing a bit: stress. Stress is the body's response to a fight or flight mechanism for any positive or negative demand made on it. The first stage includes an alarm reaction, when the body starts to adjust and responds with physical responses. In the second stage, resistance occurs and the body compensates physiologically. The stage of exhaustion results in the body's inability to resist the stressor. Stress can be positive or negative, and coping mechanisms can be destructive or constructive. All coping mechanisms are directed at efforts to relieve stress. If a client becomes more anxious and paces in the halls, what are some physical signs of stress that you as a nurse would assess? Restlessness and irritability. Now, once you offer a client a PRN medication for agitation and you take the client's vital signs, what would you expect to find? Elevated vital signs like an increased heart rate of 96 and increased blood pressure of 146/92. In addition, the client may exhibit disorganized speech, scattered thoughts, and impaired concentration. A client might report insomnia, and if the client has diabetes, blood glucose levels might be more elevated. Cholesterol and free fatty acid levels also increase with stress. Consider this client. She's being transferred from the emergency department and admitted following a suicide attempt. This is the narrative that the ED nurse has given to the client's nurse at transfer. The client is a 36-year-old female who lives alone and was taken to the emergency department by ambulance following an attempted overdose of 10 Tylenol tablets. She was tearful and anxious and explained that her 14-year-old daughter was going to be taken away from her, and she would no longer be able to live on her daughter's disability. Several weeks ago, the client lost her job as a mail clerk and has been looking for a new job. The client is unable to identify significant support to help her cope with her problems. The client reports difficulty falling asleep at night and early morning awakening. So what psychosocial stresses is the client experiencing? She's unemployed. She's a single parent and caregiver for a disabled daughter. Due to the loss of her job, she has inadequate social support, and her anxiety interferes with her sleep patterns. And now is the time to use the restorative nursing interventions that you learned, helping the client to problem solve and to use adaptive coping mechanisms. Effective coping includes talking with the client to encourage expression of feelings rather than acting them out, and suggesting relaxation techniques such as music or progressive muscle relaxation to gain control over anxiety. Physical exercise can promote effective stress management and thus improve mood and self-esteem, decrease tension, and provide a feeling of accomplishment and renewed energy. Once the client is stabilized, the nurse can assess resources that the client has used in the past to cope with anxiety and stress. What are some of the important nursing problems that might require stress management? Anxiety, ineffective coping, altered health maintenance and ineffective management of therapeutic regimen. And remember, restoring the client's ability to cope with stress requires education about effective strategies that will reduce clients' anxiety levels so that she can problem solve effectively. Sometimes, in the case of severe depression, antidepressant medications are ineffective. In these cases, we often use electroconvulsive therapy or ECT. Initially, it was used for clients with mania or schizophrenia. ECT is a procedure that induces a seizure while the client is under general anesthesia. Clients require 6 to 12 treatments or a maximum of 20 to 25 treatments, which varies according to the client's problem and therapeutic response. The pre-ECT workup includes a history and physical, a complete blood count, urinalysis, chemistry profile, chest X-ray, and EKG. ECT can be given on an inpatient or outpatient basis. Informed consent is required prior to the treatment. Preparing a client for ECT is similar to preparing a client for surgery. The client should take nothing by mouth and remain NPO after midnight to prevent aspiration during anesthesia. The client can wear comfortable clothes, pajamas, or a hospital gown. Prostheses such as glasses, dentures, and hearing aids should be removed. The client's hair should be washed before placement of the electrodes. The client should void immediately before receiving treatment to prevent incontinence during the procedure and to minimize the potential for bladder distension. There can be muscle soreness, memory loss, disorientation, and headache immediately following the treatment. Recovery requires the typical post-anesthesia nursing care. Vital signs are taken frequently until they return to normal. The gag reflex is assessed before giving the client fluids and food. The client should be assisted with ambulation until stable. Mental status should be assessed at regular intervals until it returns to baseline, and reorientation